It's funny. Sometimes the biggest technological shifts, they don't make a big splash. They happen quietly, almost invisibly, inside machines we think we already know. And that's exactly what we're talking about today. A quiet revolution that's happening right now inside the MRI scanner.
And let's just jump right in with a pretty bold claim. You've got Vivek Malhotra from Sequoia Healthcare, and he comes out and says the high-field MRI has changed forever. I mean, that's not a small statement, right? We're talking about a cornerstone of medical diagnostics. So you have to ask, what's he talking about?
But here's the catch, and this is what I find so interesting. From the outside, you wouldn't know a thing had changed. The machine looks, well, it looks like an MRI. So if this huge revolution isn't something you can see, what exactly is it? That's what we're going to dig into.
Okay, so to really get what's so revolutionary here, you first have to understand the old way of doing things. You have to understand the big problem that this new tech solves. And for high-field MRIs, that problem for decades has been one thing: helium.
And this quote, man, it really paints a picture. You've got Manikandan Bala, a guy who's been in the industry forever, and he talks about literally climbing on top of these giant magnets just to pour in liquid helium. And then he mentions witnessing these helpless quenches. It sounds pretty intense, doesn't it? And believe me, it was.
So he mentions a quench. What on earth is that? Well, it's basically the nightmare scenario for anyone operating an MRI. It's when that super powerful magnet suddenly fails. And when that happens, poof, all that incredibly cold liquid helium keeping it stable just boils away into gas instantly. It's dramatic and, oh yeah, it is wildly expensive.
And see, the whole helium thing isn't just one problem. It's this whole cascade of headaches. First, you're constantly having to refill the thing with thousands of liters of it. Then there's the massive financial risk if one of those quenches happens. You also need all this crazy expensive infrastructure, like special pipes, just to vent the helium safely. And on top of all that, you're completely at the mercy of a global helium supply chain, which is, let's just say, not the most stable thing in the world.
So that's the problem, a big one, which of course brings us to the breakthrough, the solution. And it's a solution that really sets a whole new standard for how these things can work.
And here it is, the machine at the center of it all. It's called the Sequoia Clarity 1.5, and its claim to fame? It's India's very first high-field MRI that is 100% totally free of liquid helium. This is the machine that has people saying the game has changed for good.
Now, the key number to focus on here is 1.5 T. That T is for Tesla, which is how we measure magnetic strength. And in the world of MRIs, 1.5 Tesla is the gold standard. It's the power you need for top-notch diagnostic images. The fact that they figured out how to get that level of power and keep it totally stable without a drop of liquid helium, well, that is a serious engineering feat.
Okay, a quick clarification here because this is super important. There are other helium-free MRIs out there, but they're not really playing in the same league. Think of it like this. You've got the Siemens Free, Star, an amazing piece of tech, but it runs at 0.55 Tesla. The Clarity 1.5, though, is a full-power 1.5 Tesla machine. That means it has the same diagnostic horsepower as the big, traditional helium-guzzling scanners. It's a whole different ballgame. All right, so the tech is cool. No helium, high power, we get it. But so what? What does being free from helium actually mean in the real world, for the people who run these machines, for the hospitals, and ultimately for us, the patients? And this table just lays it out perfectly. Look at the before column for a traditional MRI. You've got liquid helium, complex pipes, a huge financial risk, and constant refills. Now look at the after column. The coolant? None needed. The infrastructure? Way simpler. The risk? Gone. The maintenance? Slashed. I mean, if you're running a hospital, this is like a dream come true. It's a huge weight off your shoulders, both operationally and financially.
And it's not just us saying it. Experts are seeing this too. Praveen Rao calls it a big leap in simplification. And that's the key word, simplification. Because when you simplify the infrastructure, it means you could put a powerful MRI machine in places you never could before. Places where it was just too complicated or too expensive. We're talking about a massive change in who can get access to this kind of life-saving technology.
But, this story is bigger than just a cool piece of technology. It's about more than just the engineering. It represents something huge, especially for the country where it was born. And here's that context. This wasn't designed somewhere else and assembled there. The Clarity 1.5T is a made-in-India product.
through and through. And that is a massive milestone for the country's own high-tech and medical manufacturing sectors.
This quote from Sudhir Bahal just nails that feeling. He talks about the pride of having a homegrown, top-tier product, and he thinks it's going to redefine the entire market. It's really about a country becoming technologically self-reliant and stepping up to compete with anyone in the world.
So where does that leave us? We're kind of standing on the edge of what's next. The engineering works, the operational side of it, it's a clear win. But the experts are asking the right questions, the questions that really matter. What do the clinical images actually look like? Are they as good, or maybe even better? And the biggest question of all, how does all this incredible technology actually help the patient sitting in that room? Answering that, well, that's the next chapter in this quiet revolution.